Dr. Tuma asked me if I would come out from New York and answer your questions. It seems that there's never time in the office to answer every question, aside from which many times a patient will come in and ask a question, and he'll give you a long, detailed answer, and 5 minutes later another patient comes in and asks exactly the same question. So obviously the best way to handle this is to bring you all together and see if we can answer all of the questions at one time. And that's what the evening is going to be, me trying to answer your questions on the subject of chiropractic. I don't know of any subject on which there is more misunderstanding than chiropractic. It seems anytime anybody wants to know anything about chiropractic, they go to the person least qualified to give them an answer and ask his advice or opinion. You'd think if somebody would want to know about chiropractic, they'd go to a chiropractor and ask him. But people are reluctant to do that, so they ask the shoemaker, the pharmacist, the television repairman, or their family physician. And you know what kind of answers you're going to get from some of those. So it's my pleasure to be here and give you the answers straight from the horse's mouth on chiropractic. In the beginning, the first part of the evening, I thought perhaps I would talk about some of the questions that have come up in the past, and then we'll throw it open to you for your questions, and we'll try and answer those. I think the biggest question that has ever come up, one which puzzles patients the most, is the question of what kind of diseases chiropractors cure. You know, when a person first walks into a chiropractor's office, perhaps it's taken him months or even years to get up the courage to take the step. He's heard about chiropractors for years. He's had a bad back on and off, going in and out for months and years, and people have said, why don't you go to a chiropractor? And he says, yeah, I will one of these days, meaning I'm really scared. So he never goes, and he puts it off, and he puts it off, until finally he takes the step. And he comes into the chiropractor's office, and the first thing that happens is he's sitting in the waiting room, not sure that backaches are best taken care of by a chiropractor, and he hears chiropractic patients talking about other things than backaches. One person says, well, I brought my husband in because he had high blood pressure, and the chiropractor cured that. And he says, now, wait a minute, high blood pressure, that's a little bit out of line from the spine. And somebody else says, oh, that's interesting, because my daughter came because she had low blood pressure, and he cured that. And somebody else claims that the chiropractor cured asthma. And somebody else says the chiropractor cured chronic constipation, or menstrual cramps, or headaches, migraines, ulcers, gallstones, kidney stones. If you sit there long enough, you'll hear people claiming the chiropractic cured everything from leprosy to ingrown toenails. And I think perhaps it's a very valid question at this stage of the game. What kind of diseases do chiropractors cure? Because that's going to lead to another very important question as to who should go to a chiropractor and who shouldn't. And I'd love to answer those too. First of all, what kind of diseases do chiropractors cure? Answer: no chiropractor anywhere ever cured anything. And no medical doctor anywhere ever cured anything. Now let's get a little understanding about health and healing. Most of what I'm going to tell you this evening you already know. You just hadn't thought about it in this light before. I want to discuss health and healing because people are always willing to give the credit where it's not due. You know, you cut your finger, the very first thing you do is you run for the iodine bottle. You pour on iodine, you wrap it in bandages, you shoot the arm full of penicillin, and a week later when you take off the bandage, the finger is all healed. And you say, you see, the iodine, the bandage, the penicillin, they healed the cut finger. But that's not true, is it? If you think that iodine and bandages and penicillin can heal a cut, well, tomorrow morning, go down to the butcher shop and bring home a steak. And we'll cut it, pour on some iodine, wrap it in bandages, shoot the steak full of penicillin, and watch and see how long it'll take to heal. Won't do it, will it? Because iodine and bandages and penicillin can't heal cuts. And you say, well, now that's kind of silly. Of course, a steak can't heal because it's dead. But that's the whole point. Life is what heals. Things that are alive have the inborn ability to heal themselves. And things that are dead don't. Life is the healer. Life is the curer. And whenever you give credit to any doctor of any kind for having cured something, you're missing one very important factor. Life is the only doctor there is. All right, you say, what is life? Mark Twain had an answer to that. Mark Twain said, life is just one damn thing after another. Thereby he solved the question that had bothered the philosophers for hundreds of years. We're going to talk a little bit about life tonight. Find out why some people heal and some don't. You know, we blame sickness and disease on a variety of things. And I want to give us some new insight into why some people get sick and some don't. Why if I cut my finger it will heal, and if I cut the finger of a corpse it won't heal. Why is it that little Johnny comes home with a cold and passes it on to his sister, and Johnny's back at school in 3 days and his sister is sick for 3 weeks? And they pass it on to the next door neighbor, and he's so weak and run down he can't fight it off at all. It turns into pneumonia and he dies. Same virus, different body resistance. And we're going to find out that the only thing that a chiropractor can ever do for you is to raise the level of your resistance. Now, if you talk to your friends and neighbors and the patients in the waiting room, they're going to tell you that Dr. Tuma and Dr. Cadell cured, as I said, everything from leprosy to ingrown toenails. And it's simply not true. The only thing they have ever done is to raise the level of resistance of your body so that your body has worked better. And when your body is working well, then it can heal just about anything. We're going to discuss this body of yours. First of all, though, I would like to change your attitude about sickness and disease. The majority of the American people think it's perfectly natural and normal to be sick. I wish you could sit where we sit sometimes, taking a case history on a patient. They're so used to being sick, they accept it so much they don't even want to discuss it. The fellow comes in to see the chiropractor, and the chiropractor says, well, tell me about your condition. And he says, no, it's just my back, doc, that's all. Every once in a while that backache goes out, and if you put it back, it'll be fine for another 6 months. And the chiropractor says, no, wait a minute, tell me about your general health. He says, no, everything else is fine, it's only my back. Will you ever get headaches? No more than usual. Now, wait a minute, what's usual for headaches? You'd be surprised how many people believe it's normal, natural, and usual to get headaches. I heard a pill an ad for a pill that they were selling in New York on the radio. You may have the same ad out here. They're selling some little pill for the cure of ordinary morning headaches. You believe this? They want you to think it's ordinary to get headaches in the morning. You wake up, you have a headache, don't ask why, don't wonder about it, pop a pill. And if the headache goes away, that's fine. Next day you wake up with another ordinary morning headache. You'll be surprised how many people think it's ordinary to get headaches. People are satisfied with being sick, so much so that they don't even notice it anymore. How many women think it's normal or natural to get cramps every month? Oh, I've always been that way. Well, damn it, the fact that you've always been that way doesn't mean that you have to be that way. That's merely evidence that your body is not working properly. Sickness and disease are not normal. There's only one thing that's normal in this life, and that is total health. I don't know what you believe about creation, and it's not really important, except that this body was created by some kind of wisdom. Whatever created all things, created this living body. We're told by the scientists, this body's supposed to last us from 120 to 150 years. Now, do you believe that whatever it was created a human body, made it to last 120 to 150 years, getting sicker and sicker and sicker along the way? I don't believe that for a minute. I believe that health is a natural state of affairs, that this body is supposed to live its total life in health, that you're supposed to be healthy from the time you're born all the way through, that life should be rather like a candle that burns brightly from the beginning all the way down to the very end, and then sputters once or twice and goes out. And if you're not getting that kind of health, if you are having sickness instead of health, it's not for no reason at all. Every sickness is a result of some cause. And one of the things we're going to do this evening is discuss the causes and find out why is it that one person dies of a liver condition at age 50, and another one dies of a heart condition at age 96, and his liver is so strong they have to beat it to death with a stick. Now, I'm going to suggest that this entire body is supposed to last you as long as you live. That life should be rather like a candle, burning brightly from the beginning all the way down to the very end. Then sputters once or twice and goes out. That's what you're entitled to. Health is your God-given birthright. This body was created by all of the wisdom of the universe to last 120 to 150 years, and it's just not natural for a gallbladder to go bad at age 35 or 40. Good Lord, when somebody gets sick, we're so used to it today we don't even question it. The President of the United States had gallstones. They called in all sorts of experts from around the country to examine him. They cut out his gallbladder. which may or may not have been necessary. I don't know. I didn't examine the case. But one thing I do know, that cutting out that gallbladder didn't make him healthy. You can't be whole or healthy when you're missing a vital organ. Now, I'm not saying he can't get by without it. He can. But the gallbladder has the job of metabolizing cholesterol. And if you don't have a gallbladder, your body can never use cholesterol properly again. So he is doomed now to eternal sickness. Either that, or whatever wisdom created this body didn't know enough about what was needed and what wasn't, and put in unnecessary parts. Do you believe there are unnecessary parts in the body? I don't. And in that I include the appendix and the tonsils and the uterus. These are useful organs, in spite of what you're told when they cut them out. A wisdom far greater than mine decreed that the body needs a gallbladder. You can't be healthy without it. But what bothers me even more than the fact that they cut it out, maybe it was desperation, they had nothing else to do to save the man's life, and I don't know whether that's true or not. But think of this, when all of these great experts came in and examined the President of the United States, we must assume he had the best doctors. Not one of them asked the question which bothers me. Why did he get gallstones? Where did they come from? You think he got them from Hubert? Did Ladybird put him in his chicken soup and send him matzo balls? Come on, where do you get gallstones from? All right, we're going to make a little examination of the body here and disease, and I want to point out something interesting to you. That you've been blaming sickness and disease on the wrong things all of these years. That every disease comes from but one cause. And that one cause is a body which is not doing its job. If this body were doing its job, if it were working right, you wouldn't be sick in the first place. There's no way that you could be sick if your body were doing its job. I want to tell you a few things about your body, about how great it is. And in doing that, change your attitude that sickness and disease are normal or unavoidable, or to be blamed on things outside the human body. Let's go on and take a case history on a patient. We ask about headaches. We ask the patient, well, do you ever get headaches? He says, no more than usual. What else? Well, are you allergic to anything? Oh, well, I have hay fever, but I've always had that. He's willing to live with hay fever, and he's convinced that hay fever is caused by ragweed pollen, which is the most absolute nonsense I ever heard in my life. If ragweed pollen caused hay fever, we'd all have hay fever. We all breathe in the ragweed pollen. No, the cause of hay fever is a body which is not working right to neutralize that ragweed pollen. We all breathe it in, we're supposed to. But if the body is working right, it has a mechanism to make chemicals to neutralize that pollen. And a healthy person makes those chemicals. He doesn't even know there's pollen in the air. Only when your body's not working right, when you're sick, run down, weak, chemically out of balance, then your body doesn't manufacture the right chemicals and you get symptoms. But the average person, when you write that history down, he assumes that ragweed pollen caused his hay fever. I had lunch with somebody yesterday who told me that cabbage causes indigestion. Cabbage gives him indigestion. If cabbage caused indigestion, we'd all have indigestion. I sat there right in front of him and ate the cabbage. Didn't cause indigestion. The cause of indigestion is not cabbage. The cause of indigestion is a stomach which isn't working right. That's the only cause. If your body were working right, you couldn't have indigestion. Let's stop blaming sickness and disease on outside things. We had a patient that came into us. He had a condition diagnosed as arthritis. It's an interesting case. Let me tell you about this. Many of you are familiar with arthritis, unfortunately. This is an attorney who had two conditions, actually. One was pains in the muscles, pains in the joints of both shoulders. He couldn't raise his arms without excruciating pain. And the other was every night when he went to bed, his toes would curl up in cramps, and he'd get these cramps all the way up the calves of his leg. And many of you that have had arthritis have had these cramps along with them, and they're probably more painful than the arthritis itself. Well, he went to two specialists that he was sent to by his general practitioner. The first one dealt with arthritis. And as a matter of fact, he was on the staff of the Hospital for Joint Diseases in New York City. And this man made an examination of his joints and found calcium deposits building up in the joints. And he said, well, there's two things we must do. The first thing is, of course, a shot of cortisone. Now, many of you have had shots of cortisone for arthritis, and you know they work up to a point. For a while, the cortisone will dissolve the calcium, and you feel better. But then, of course, when the cortisone wears off, The pain comes back either in the same joint or in another one and builds up again. You need another shot of cortisone, then another and another and another, until finally the side effects of the cortisone are more deadly than the disease, and you have to stop taking it. You know, here's another thing that bothers me. Didn't it ever occur to any of the mental giants that are treating arthritis with cortisone shots that perhaps if cortisone is an effective treatment, perhaps the cause of arthritis is a shortage of cortisone? Your body makes cortisone. As you sit here right now, your body is making cortisone in the adrenal glands. In the adrenal cortex, you make adrenaline and cortisone out of the very food that you ate for lunch today. Most people don't realize that your body makes not just adrenaline and cortisone and insulin and antibodies and antihistamines. Your body makes every drug and every chemical you will ever need through life. If your body were working right, you wouldn't need any drugs or chemicals from the outside. If you just get the right quantity and quality of food, and if your body's working right, it will convert that food into the chemicals that you need. So, a shortage of cortisone comes from only one cause, a body which is not working right. But let's go on to our poor patient with the arthritis. And they gave him his cortisone shots. They also gave him a special diet that eliminated all calcium. They said, you have too much calcium in these joints. And they gave him a diet that eliminated all calcium so that his body wouldn't build it up. Then he went to see his other specialist for the cramps in the muscles of the legs. The man he was sent to see there was a hematologist who took a sample of his blood and examined it in a laboratory. You know what they found? A shortage of calcium in the blood. And they told him after every meal you must swallow 2 of these calcium tablets, big dollar-sized pills, you see. Now, did he have too much calcium or too little? Well, neither one. The only problem was his body wasn't using it properly. Up here in the throat, there are 2 little glands called parathyroid glands that have the job of metabolizing calcium. Now, if they're working right, the calcium is properly used. And if the body's making the right amount of cortisone, you couldn't get these leg cramps, and you couldn't get arthritis. Now, people often say, well, what can chiropractic do for arthritis? The first thing it can do is prevent it by keeping your body working properly. Let's go on and discuss some of these other things that we blame on outside elements, outside factors. As we sit and take a case history, we ask a patient, for example, do you ever have digestive problems? Any indigestion, heartburn? He said, no, nothing at all there. No, nothing at all, no gas pains? No, not a thing, Doc. Gee, that's beautiful. Can you eat anything you want? Well, no, I can't eat cabbage. And I can't eat pickles. And I can't eat pizza, and I can't eat sausage, and I can't drink beer, and I can't drink coffee. They go through a whole list of things they stay away from. Of course they don't get indigestion. They don't eat anything. They go through life avoiding all the foods, pretending that that means they're healthy, instead of which they're catering to sickness all of their life. Do you ever get constipated? Oh, not me. I take a laxative every night. See? And they kid themselves that this is health. And when they do get sick, they blame it on the weirdest things. We blame sickness, for example, and probably the weirdest thing of all in blaming disease is blaming it on bacteria and virus. Now, there are enough staphylococcus and streptococcus in this room right now to kill off the whole population of the state of Michigan. There's no way you can breathe a mouthful of air or eat a mouthful of food without loading yourself up with bacteria. If bacteria could make you sick, you'd already be dead. The fact is, as long as your resistance remains high, as long as your body is strong and healthy, you have a mechanism to live in this environment. This body was created by all of the wisdom of the universe to live in an environment where bacteria are normal. And as long as the bacteria count is not disturbed by man's stupidity with these little blunder drugs, and as long as the body remains strong and healthy, it can live in this environment. If little Johnny comes home with a strep throat, he goes running off to the doctor. Do you think the doctor believes that the streptococcus are the problem? If he did, you think he'd look down little Johnny's throat and say, cough? He doesn't want that stuff on him. Do he? He doesn't believe it. If the medical profession believed the germ theory, they wouldn't practice what they do. In fact, if the germ theory were correct, there'd be nobody left alive to believe it. You know, when I was a little kid, I was taught that the only way you can get tuberculosis is from somebody who has it coughing in your face. But then I said, if that's true, where did he get it from? Well, he got it from somebody coughing in his face. And where did he get it? Well, somebody coughing in his face. And who coughed in his... If you go back far enough, you find Adam and Eve must have had TB. As well as every other communicable disease. You know, the only way you can get gonorrhea or syphilis is from somebody who already has it, too. And Adam and Eve must have been some swinging couple. If you want to believe the germ theory. Do you know there are nurses working in TB hospitals for 30 and 40 years? How come the nurses don't get TB? The patients cough and splutter on them all the time. How come the nurses would work there? I'll tell you how come. Because they know that a good, strong, healthy body can't get tuberculosis. If I take a swab of your throat right now, I'll find that tubercle bacillus. But if you remain strong and healthy, get good rest and with a good nerve supply and a strong body, you can't get TB. But if you get weak and run down and sick, that's when the tubercle bacillus breaks out of its encapsulation and takes over and spreads. But when the body is strong and healthy, you can't get TB. You see, the medical profession and the nursing profession know better. It's unfortunate that the public doesn't know. I asked a medical doctor one time, a surgeon, and he had one of these surgical masks on. And I said to him, what's that for? You know, they won't let you into the hospital to look at a little baby unless you wear a surgical mask to keep the germs out. And you hold one of these things up to the light and you can see through the bloody great holes in there. Now, those germs are tiny little things. I asked the surgeon, I said, how big are these germs? And he described these submicroscopic little things you have to... And I said, well, now look at this mask for a minute. And I showed him the big holes in there. I think I must have totally destroyed his faith in that mask. I don't know what he's doing for a living now. But I found out why surgeons wear masks. The same reason Jesse James wore a mask. Well, why not? They wear rubber gloves so they shouldn't leave any fingerprints. The fact is, a good, strong, healthy body doesn't get bacteria. What about the common cold? We blame disease on the virus. Now, there is a virus associated with the common cold, but a good, strong, healthy body doesn't get it. As I said, little Johnny comes home with the cold, and he passes it on to his sister. His other sister doesn't get it at all. She fights it off before she ever gets it. The virus alone can't cause a cold, and the bacteria alone can't cause disease. The thing that must be there for these bacteria or virus to produce a problem is a weakness, a run-down, overtired, not working properly body. When you have that kind of a situation, then you don't have to find any strange virus at all. The virus that's already in your body right now will manifest itself, break down tissue, and start to become a problem. The cause of sickness and disease is a weak and run-down body. It's not something from the outside. But we blame sickness and disease on the most idiotic things, or we pretend that they come from nowhere. Most of the time when you get sick, you don't even ask why. You just say, oh, I'm sick. Doctor, cure me. Whether it's a medical doctor or a chiropractor, you don't even ask why. Yeah, oh, I'm sick. I have kidney stones. Fine, where did they come from? Did you swallow stones that got down in there? Where did the kidney stones come from? Well, they only come from one place, from a body that's not doing its job. You know what we want to do in chiropractic? We don't want to cure your kidney stones. We want to get your body working properly again so you wouldn't get kidney stones in the first place, or gallstones, or colds, or tuberculosis. We want to raise the level of function of your body. Let's talk about cancer. Everybody wants to talk about cancer. They're really scared to, but they want to talk about it anyway. Where does it come from? Well, one thing's for sure. A healthy body can't get cancer. There's no way a healthy body can get cancer. Now, I'm not offering chiropractic as a cure for cancer or a cure for any other condition that I mentioned. But by golly, if we could keep the level of your resistance high, keep your body working properly for the next 50 or 60 or 100 years, that would reduce your chances of getting cancer, wouldn't it? It would reduce your chances of getting anything. And that's all chiropractic wants to do, is to keep your body working properly. I don't want to impress you tonight with how great chiropractic is. I want to impress you instead with how great your body is. Once you know what a fantastic doctor you have inside you, working for you day and night, 24 hours a day, then you'll have a little more understanding and a little more confidence, and you'll be less likely to go running for the pill bottle. Let's talk about this fantastic body of ours. The body consists of, we are told, between 25 and 30 quadrillion cells. Now, everybody you know wants health. You look for health everywhere. You go to the medical doctor for it, the osteopath, the chiropractor. You say, hey, doc, sell me some health. Most people don't even know what health is. So first we're going to discuss what health is. And it's a very simple answer. Health is merely a condition in which those 25 to 30 quadrillion cells are doing their job. When those cells are working properly, you have cells to neutralize bacteria, you have cells that digest all kinds of foods, cells to manufacture hydrochloric acid, cells to neutralize hydrochloric acid, cells to fight off foreign protein or to neutralize it. Your body makes histamines and antihistamines. You have cells to make all the drugs and all the chemicals. You have cells to see with, cells to hear with. There are special cells to do hundreds and hundreds of different jobs. There are even special cells to control your blood temperature and special cells to control your heart rate. And if all of those cells were doing their job, there's just no way on God's earth you can get sick. Now, we don't want you to treat your diseases, but we do want to get your cells doing their job. That's the purpose of chiropractic, to get those 25 to 30 quadrillion cells doing their job again. And we think we can show you how that can be done through chiropractic and only through chiropractic. There is no other healing art at all that relates itself to health the way chiropractic does. Chiropractic is not like anything else. It's not a substitute for anything. It's a totally different attitude and outlook towards health, based upon the physiology of the body. Let's talk about this body of ours. As you sit here right now, for example, your liver alone is performing perhaps some 350 different functions without your thinking about it. That's a pretty smart little body. We live in an age where we worship science. For some reason, the more a man knows, the more we get down on our knees and idolize him. We can't wait to applaud these fellows who build atomic bombs or can build ships to walk on the moon. And so when it comes to healing, we turn to the man of the greatest knowledge and the greatest wisdom, and we ask his opinion. Let me tell you a little something about those wise men. All of the scientists, all of the chemists, all of the doctors in the world put together couldn't make a blade of grass. And yet this living body knows how to make living tissue. I went to school a long time ago and I learned the chemical formula for insulin and the chemical formula for adrenaline. But long before I learned them in school, my body was making those chemicals. Now, how did my body know? Because there's an inborn wisdom in living things that knows how to make adrenaline and insulin and all of these other chemicals. And that corpse over there doesn't know. There's something about life that has its own wisdom. Your chiropractor explains it this way. He says there is inherent within every living thing a wisdom which enables it to survive through life. Now, your chiropractor calls that the innate intelligence of the body, the inborn wisdom with which the body functions, by which a newborn baby can convert his food into walking, talking flesh and blood. And as you sit here right now, you don't know what jobs your liver should be doing, but your body does. You don't know what your heart rate should be, or your respiration rate, or your blood temperature, but your body knows, and it's regulating these things with a control outside of your thinking mind. Which is just as well, if they left this thing to your thinking mind, and if you have a thinking mind anything like mine, my wife gave me 5 things on a shopping list. I forgot 3 of them, so she wrote them down. Then I forgot where I put the list. Now, if that mind had to run my body, if I had to remember 350 different things for my liver to do, I'd die, wouldn't I? If I forgot the formula for insulin, and I couldn't make it anymore, I'd be in terrible shape. So Old Mother Nature, in her wisdom, takes this job out of the hands of my thinking mind and puts it back in a part of my mind which the chiropractor calls the innate intelligence of the body, the inborn wisdom that runs the body. And that inner wisdom never makes mistakes. It knows exactly what it's doing all of the time. And we in chiropractic say, let us put our health in the hands of that inner wisdom of the body instead of asking the mental giant who went to school for 95 years. Because anything those mental giants learned about the human body, the body already knew before them. We asked the IBM people in Poughkeepsie, since mankind is so determined to have his body run by educated experts, let's get an educated brain that doesn't make mistakes. Let's get one of these computers that they put inside these moonshots. You know, these little black boxes can do in seconds the job that it would take a team of scientists 10 years to perform by hand. And they have these electronic brains perfected at that point. So we said to the IBM people, well, why not manufacture an electronic brain capable of running the human body? Instead of asking doctors what to do, let's have a little black box do the think. So we asked them, what would it take to build an electronic brain to run a human body? And they fed into their computers all the data about the size and shape and number of cells and number of jobs. And just think about this, 25 to 30 quadrillion interrelated parts working at the same time. What would it take to run them? And they said, well, it's very simple. If we were to use the latest transistors, these tiny little miniaturized transistors, we could build a machine capable of running the human body. It would have to be pretty big. It would be about as high as the Empire State Building and as big around as the entire state of Texas. That's what it would take to run your body. And yet there's an inborn wisdom in your body that's running it now. And not just in the mental genius, but in the mentally retarded child. His body's running itself the same way too, with the same wisdom. The newborn baby knows how to make living tissue out of the food he eats. And yet when we get sick, what do? We don't turn to the body and say, what's wrong? We turn to some expert who studied the body and say, you tell me what's wrong. We don't even ask him to tell us what's wrong. We tell him how to put it right. Put it right without even knowing what's wrong, or without even assuming it is wrong. So what I want to do today is change your entire attitude about health. I want you first to stop accepting sickness and disease as normal. You don't have to go through life sick. That's number one. And the second thing is to put your confidence for health and healing not in doctors, not medical doctors, not chiropractors, not any kind of a doctor. There's not one of them knows a damn thing about running your body, including me. But your body itself has an inner wisdom that knows what to do and does it 24 hours a day, awake or asleep. Let me give you one more example of how great this human body is, and if this doesn't convince you, then I give up. Let's think for a moment of the development of a new human being from two little cells. There's a tiny little female egg cell, about the size of a dot made by a fine-pointed pencil. That meets up with a male sperm cell that is even smaller. Maybe a little smarter, but smaller, all right? These two cells get together and form one cell, which then is going to grow a little bit and divide in two. And it'll grow again and divide into 4, 8, 16, 32, 64, 128, 256, 512. Just keep multiplying. Well, there's nothing smart about multiplying. Even a cancer can do that. But then, as this thing gets to look like a little mulberry, it gets kind of a dent in the side. And certain cells begin to change. And around that little dent, the first organ of the body forms. And funnily enough, it's always the same organ. In every single case, it's always the brain and the spinal cord that form first. You know, when it first started, every cell had as much claim as any other cell to be the original one. They should all be alike. How come some of them become brain and spinal cord? And then after the brain and spinal cord have formed, they seem to take control and other organs begin to form. Some cells become bone, and some become heart, and some become eyes and can see, and some become spleen, and some liver. Each cell knows what to become, and as though around some invisible skeleton, a whole human being is formed, without any doctors, any professors, any scientists. The inner wisdom of the body knows what to do, and in 280 days, a perfect human being is formed, without any help. And after 280 days, little Junior's ready to come out. Hey, Mom, let me out. And sure enough, out he pops into the world. From that moment on, we assume now that nature doesn't know anything more about it. Now we need a doctor. Do you really believe that whatever wisdom created this body now quits? Good heavens, the thing is born maybe 20 inches long, weighing 6.5 or 7 pounds. He's going to grow up to be 6 feet 8 and weigh 290 and play tackle for the New York Giants. I hope. God knows we need one this year. All right? Well, when he grows from this size up to full size, he's growing in proportion. How do you think those fingers know to grow to a certain length and then stop? They don't just keep on growing. There's some wisdom there that tells them when to stop. There's some knowledge there of what shape a heart should be and how big it should get. And what it's supposed to do. There is an inner wisdom in living things, and it doesn't quit at birth. As The body grows, every part of it grows proportionately. Except for one thing. Here's an interesting thought. Deep inside the ear are 3 tiny little bones called ossicles. And while all the rest of the body is growing, these 3 little ossicles don't. They stay the same size. And for years and years and years, the scientists were stumped as to why, when everything else is growing, these little bones didn't. Then they found out something interesting. If they did grow, if their size ever varied, you wouldn't be able to hear. They have to be exactly that size at birth and remain that size through life if the hearing mechanism is to work. Now, science just found that out. But newborn babies have been knowing it for thousands of years. There's an inner wisdom which controls the growth, not haphazardly, but in an intelligent manner, so everything grows. Don't you think it's just a lucky break that you have 2 holes in your skin where the eyes come? Well, isn't that fortunate? You notice how everything is custom tailored for you. Everything fits perfectly. Your fingers just happen to fit your hand. They wouldn't fit the person next to you, but they fit you perfectly. Everything is custom tailored. And if there's an accident, an injury, and one part is distorted or deformed, other parts compensate and adapt for it without any doctors around to tell it what to do. There is an inner wisdom guiding life and controlling growth all the way through, and that doesn't quit when the body is fully grown. Perhaps if we understand this, we'll understand all of the secrets of healing. I said that this body is supposed to last you 120 to 150 years. That's the scientist figure. Incidentally, that figure just happens to agree with the Old Testament figure also. Interesting how they coincide. I also said that the body consists of between 25 and 30 quadrillion cells. But the cells of the body don't last any 120 years. You know how long your cells last? Your heart cells, for example, last about 90 days. And then they die. If you brush your hand, you'll brush off thousands, millions of dead cells. As you sit here right now, your heart cells are dying. Yeah, but don't worry about it, because as one dies, nature makes a new one out of what you had for supper tonight. Just think of this. What did you have? What did you have for lunch today? One of those Whoppers, those hamburgers? Maybe you had some peanut butter and jelly sandwich and a glass of milk. As you sit here right now, your body's converting that food into walking, talking, thinking flesh and blood. Your very brain is made out of the food you ate. So when you go to the big doctor and you ask his expert advice, I don't care what kind of a doctor, you're asking his brain to do some thinking about your body. Yesterday, his brain was a peanut butter and jelly sandwich. Now it's converted, and that's going to do the thinking about your health. So I say, don't ask the peanut butter and jelly. Ask that wisdom which converted that peanut butter and jelly into living tissue. There is an inner wisdom converting that food into new tissue. And as you sit here right now, your body is making new cells. As I said, the heart cells last you about 90 days. Then they die, and a new one is made out of the food you ate. Your red blood cells, they last about 120 days, and then they die. And they go through the spleen, and they get all mashed up. Some of the material is reused. The rest of it is eliminated as waste. By the time 14 months has gone by, every vital organ in your body has been replaced. And by the time 7 years has gone by, every single cell in the entire body, bones and all, has been replaced, with one exception. Yeah, you've guessed it. The cells that started it all, the most vital organ in this entire body, the brain and spinal cord, the first one to be born, to be created, the one that regulates and controls all others, that has to last you all of your life. It does not get replaced the way the others do. May I give you a little piece of advice? And I'm not one for giving advice. But since you're only going to get one brain and spinal cord, may I suggest you take care of it? Everything else in your body is replaceable and expendable, even your heart. But your brain and spinal cord are the only one you're ever going to get. Take care of them. The most vital organ in the body. But other than that, everything else is replaced constantly. By the time 7 years has gone by, you have a brand new body, bones and all. You fellows that have been married 21 years, you're on your third wife already. What do you mean you like the old one better? Come on, that's not nice. Well, as we understand this, we begin to understand all of the secrets of healing. When the cells of your body get sick, we don't have to cure them. You go to Dr. Toomer or Dr. Cadell and you say, you've got these sick cells, or those sex cells, sex cells, yeah. Woo! English major, too. Having all of those sick cells, you say to the doctor, well, can you cure them? And of course he can't. He can't heal sick cells, but what's even more important, he wouldn't want to. Let those sick cells die. Even the healthy cells are dying. And even nature herself can't heal a sick cell. If medicine has failed for 5,000 years, and it really has, hasn't gone very far. And I think the reason is they've been trying to cure sick cells. Sick cells cannot be healed. Even nature can't heal a sick cell. When a cell gets sick, let it die. Then nature will create a new one to replace it. Now, if the new cell comes in healthy, the sickness and disease pass from the scene. And whatever doctor you've been going to at the time gets the credit. But if the new cells come in as sick and run down and weak as the old ones, then the disease goes on and on and on. And it's that simple. This is the answer to all healing. When you heal, it is because your body has made new living cells, strong and healthy, to replace the old ones. And if you have not healed, it's because sick cells are being replaced by more sick cells. So that this body, in replacing sick cells, actually can heal anything. I'm sure as you come to the clinic here for your chiropractic care, you wonder what can be cured under chiropractic care? What kind of diseases? And I said, well, chiropractors don't treat diseases. They certainly don't cure diseases. But your body is capable of healing from every disease condition known to man. I had a debate on radio. I don't know if you get the program out here. On WOR out of New York City, there's a show called the Barry Farber Show, in which I had a debate with a medical doctor on the subject of chiropractic. And he brought up the very interesting topic of cancer. That's topic of cancer. That's a different thing. All right. He brought up cancer, and he said, well, now, can you name a single cancer patient who got well under chiropractic care? So I did. And I told him the story. I'm going to relate it to you very briefly. I don't want to go into details. We haven't the time. The patient's name was a fellow by the name of Bill Allen. And I can tell it to you because it's been made public knowledge. A book has been written on the subject. Bill Allen was in the United States Army. And he got sick, and they sent him to the base hospital, and from there back to the Walter Reed Hospital, where they did exploratory surgery. They opened him up and found he was so loaded with cancer, he was labeled inoperable. They sewed him up, sent him home, and the United States Army gave him 30 days terminal leave to go home and set his affairs in order. Well, he just wasn't ready to cash in his chips yet. And it's funny how when you hear that last hope call, how when you're desperate enough, then you're ready to turn to chiropractic. How many people here, for example, would never have come to a chiropractor if they could have received help elsewhere? They'll only turn to chiropractic in desperation. If you ever wonder why the medical profession hates chiropractors, this is your answer. The vast majority of all patients that get well in a chiropractor's office are medical rejects and medical failures. If medicine could have helped them, they'd never been under chiropractic care in the first place. So after medicine has failed, they turn to us, and when they get well, how does that make the MD look? Naturally, he's embarrassed, so he doesn't like us very much. And here was a situation where Bill Allen was told, go home and die. And he said, well, hell, I'll try the witch doctor first. So he went to the local witch doctor, who was a chiropractor, and he said, what can you do? And the chiropractor explained chiropractic and sent him out to a place called the B.J. Palmer Chiropractic Research Clinic in Davenport, Iowa. Well, he went out there and he stayed there for a year. Now, this is a man who was supposed to have been dead in 30 days. A year later, he was discharged from the B.J. Clinic, went back to his hometown chiropractor, and stayed under his care until he went back in the Army. Served out his time, was discharged finally with the rank of colonel, went back out to Davenport, where he enrolled as a student in the Palmer College of Chiropractic. 4 years later, he graduated from there, is to this day a practicing chiropractor in the town of Macon, Georgia. Now, it's over 30 years now since this man was given a 1-month death sentence. And I told this story to Dr. Livingston, the medical doctor, only because he asked. He brought it up. And you know what he said? The same thing that any medical doctor would say to you if you told him about a chiropractic success. You've tried it, you know what they say. The first thing he said was, well, mistaken diagnosis, because he wasn't that polite. He said to me, who was the idiot who made the diagnosis of cancer? And I said, well, that idiot was the chief of surgery at the Walter Reed Hospital, who incidentally later went on to become Surgeon General of the United States. So the diagnosis was pretty well solidified, in addition to which, one good thing about the Army, perhaps the only good thing about the Army, they do keep good records. And the Walter Reed Hospital has on record to this day the frozen section slide from which the diagnosis of cancer was made. There's only one way to diagnose cancer, and it's not done by X-rays or any other thing. The only accurate diagnosis for cancer is when you operate and you take a little slide of tissue and you study it under a microscope. Even then you're not 100% sure, but that's as close as you're ever going to come. So this slide is still there, and sure enough, I've checked it, it is a raging cancer. There was no question of the diagnosis. And then Dr. Livingston came out with this other little gem. He said, you know, you still haven't proved that chiropractic got him well. He said, we've got thousands of cases on record every year of cancer patients getting well all by themselves. Without medicine, without drugs, without surgery, without x-rays, certainly without chiropractic. Now, we call that spontaneous remission. It's very common. How can you claim that chiropractic cured this one? Oh, but you see, that's the point. I don't claim that chiropractic cured this one or anyone, but I want you to mark well what Dr. Livingston said. There are thousands of cases on record every year of cancer patients getting well all by themselves. This body has the ability to recover even from cancer, even without chiropractic. All we say is this: if we, through chiropractic, have raised the level of resistance of that body, then the chances of recovery are a little bit better. What I want to point out to you is that there is no such thing as an incurable disease. There is no disease that is incurable. There are incurable patients. There are some patients who've just gone so far that there's not enough residual strength left in the body for them to fight back. But that would hold true regardless of what name you give the disease. But there's no disease for which no patient has ever recovered. I was reading up recently on 2,800 syphilis cases untreated in Sweden. And over a 20-year period, 80% of them recovered 100% totally. And these are untreated cases. So this body apparently, and these people incidentally were even without chiropractic care, the recovery rate was that high. So apparently this body has the ability to recover from disease. And there's no such thing as an incurable disease. Good Lord, we label so many things as incurable. Technically speaking, the common cold is incurable. There is no cure for the common cold. Of all the cures that don't work, I like Scotch whiskey the best. It doesn't work any better, but it's more fun, you see. And even though there's no cure for this disease, everybody in the room has had a cold at one time or another. You don't have it now. Who cured your cold? Who cured it? Not Dr. Cadell, not Dr. Tuma. You cured it. Your body recovered and healed itself. And it will recover and heal itself from every disease condition if it's given a fair chance. That's the kind of body you have working for you. If your body were working right, you wouldn't get sick in the first place. And if because your body is not working right, you did get sick, then the body will heal it as soon as the body is once again able to work properly. Now that's the simple truth of chiropractic. Your body does all the healing, even though you want to give the credit to the chiropractor. We can't cure a darn thing, but we can allow your body to function at its optimum level. And this body's fantastic. It can heal and recover from every disease condition known to man. I've seen so many cases. Let me tell you about a couple of cases. You have a minute? You're not going anywhere. The doors are locked, all right? Let me get comfortable here. The late show doesn't come on for 3 hours yet. Relax. I want to tell you about a couple of cases, things I've seen personally. I think of a radio show about a year and a half, much more than that. About 3.5, 4 years ago, I did a radio show on which a lady called in. It was a hotline show. A lady called in and asked, what can be done for mentally retarded or brain-damaged children? What can you do if there's permanent brain damage? And I said, well, if there is permanent brain damage, obviously it can't be healed. That's what the word permanent means. But first of all, I don't accept the diagnosis as permanent. We don't know if it's permanent or not. If it'll heal, then they'll say, well, it wasn't permanent. Secondly, even if there is permanent brain damage, it now becomes more important than ever that the undamaged cells get a good, strong nerve supply to compensate and to make up for it. I would suggest that these people get on to chiropractic care. Well, sure enough, she arrived at my office the next day with twins. Now, at age 1, these twins had finally been diagnosed as being mentally retarded, brain damaged, spastic, cerebral palsy, and having a condition called Hirschsprung's disease, which is a congenital absence of bowel movement. There were two girls, aged 3.5, and at age 1, when that diagnosis was made, their mother had been told, put them in an institution and forget you ever had children. First of all, there's no hope for any improvement whatsoever, and secondly, the chances are they're not going to live beyond age 4 or 5 anyway. And from age 1 to 3.5, the mother didn't keep them in an institution. She kept them home, but she didn't have much hope. By the time they got to us, one had had 3 major surgeries, and the other one had had 6 major surgeries. One was on a teaspoon and a half of phenobarb a day to try and prevent convulsions, which would result in further brain damage. When they came in, each of them had arms locked across the chest in such a way that my associate and I had to use all of our strength to pull down and straighten those arms so we could lie the baby down and check the spine. Their feet and knees were locked across the abdomen in the same way, both of them crossed over and locked. The head was thrown back, the eyes rolled back in the head. They were totally deaf, unable to swallow. Neither one had ever had a normal bowel movement. One had bowel movements daily by means of an enema, and the other one had had surgery called a colostomy, in which they cut into the body, sever the large intestine, sew off that part leading into the rectum, and take the upper part and empty it out through a plastic tube into a plastic bag. And then daily, instead of changing diapers, mother would change a plastic bag. This is the condition of these kids, unable to swallow, totally deaf, no finger movements, nothing. And mother said, what can be done? Well, I knew only one thing, that restoring nerve supply in these kids could do nothing but good. It may do no good, but it certainly couldn't do harm. So we started then gradually to do what we could in adjusting these children. Within the first day, that child that was having the enemas started to have normal bowel movements, and has had normal bowel movements daily from that point to this. There was an immediate internal relaxation of spastic muscles. The so-called Hirschsprung's disease has never been seen since that first adjustment. But gradually, as the days and the weeks and the months went by, we saw other changes. Fingers began to relax. Arms began to relax. The head assumed a normal position, and the eyes began to focus. They still don't focus terribly well in the one child, but they do focus occasionally. I think one of the most dramatic recoveries was when mother came in one day and told us, as she went into the room one night and went to close the door, the wind grabbed the door and slammed it, and both kids sat up in bed and started crying. They'd heard a noise for the first time in their life. 2 children, now aged 4.5, who had been totally deaf and now could hear for the first time at age 4.5. And now they're 8 years of age now, and they're continuing to grow. They're both standing, incidentally. Not all the time. One came in the other day with 7 stitches across her head where she pulled a television down on her head trying to stand up. And you've never seen a mother so thrilled in your life at seeing a kid with stitches as they started to stand. They pick up foods and they eat them. They're beginning to say words like mama and dada and cookie. One of them now is going into speech therapy, starting to be taught words. The other one will probably be going in about another 6 months. And so we see progress here. And perhaps the most remarkable change of all took place in the child who had the colostomy. And this colostomy surgery had been done twice. The first time it had failed. The mother began to notice traces of something in the diaper, and the diaper shouldn't have anything in it. She went running back to the surgeon, and sure enough, the colostomy had failed, peritonitis had set in, and there was emergency surgery necessary to save the child's life. Now, after about 8 or 9 months of chiropractic care, again, traces began to appear in the diaper. And mother went rushing back to the surgeon. He examined the child, said he couldn't find anything wrong. This must be something that was left in the rectum since after the surgery. Now, the surgery had been a good 1.5 years, 2 years before, and it seemed to me an awful long time for that stuff to be hanging around. But he's the surgeon. He knew his business. I said nothing. But the next day there was more there, and the next day more, and she went back to the surgeon again and showed him a full diaper, and he said, no, nothing, just what was left in there. Well, by this time it was obvious this wasn't stuff left in there. I know if it had been me, I'd have taken that empty, nothing diaper and asked for a little more action. Well, finally, after a couple of weeks of this, he did agree to investigate a little further. And he undid the colostomy tube, inserted a dye, a barium enema dye, in through the colostomy, pumped it through the the GI system and x-rayed it. You know what they found? This little baby has grown another bowel. A brand new one leading into the rectum. She's now having perfectly normal bowel movements again. Nature has circumvented the surgery. Now she has to undergo one more surgery to take away that colostomy. She's still got a hole in her side, a plastic tube sticking out there. And mother's just trying to get up enough courage to take her back to the surgeon for one more surgery. Now, I don't point this out to you as a miracle of chiropractic. I point it out as a miracle of what this body can do once it's allowed to function normally. There are no limits. People come to me and they say, gee, Doc, I'm too far gone for help. And I say, nonsense. There's no knowing what recuperative powers there are left. I don't care if your kids have asthma or whether you have arthritis or what the condition is. There's no condition which will not benefit from a good, healthy nerve supply. You know, I've been telling you how great this human body is, and there's almost nothing this body can't do. I want to tell you one more little example, and I can think of case after case after case. Oh, I got another one. Let me tell you several of them then. I told you you're going to be here till the late show. Here's one, somebody who was shot in the Korean War. A bullet ricocheted up a wall, entered the chest wall, and lodged in the heart. Didn't enter, didn't go all the way in, but lodged in the heart, and the surgeons decided if they cut out that bullet, he would bleed to death. Remember, this is back in the 50s, before open heart surgery had been perfected to the point that it is today. They decided he was safer if they left him alone. So they left him alone, and they x-rayed him every 6 months. And as the months went by, and this patient never saw a chiropractor, didn't even know the meaning of the word. As the months went by, that bullet began to move out of the heart as the body grew new tissue behind it and forced it farther and farther and farther away. And the heart healed up totally behind it. There wasn't a leak of a drop of blood. The patient was 100% healthy all of this time. When the bullet was about half an inch from the heart, they went in and cut him open and took out the bullet, and that was the end of it. So I don't even know why they bothered at that stage of the game, but they did. I saw the bullet after it was removed, and here's the fascinating thing. Here's this nickel-jacketed bullet. This is tough stuff, meant to penetrate, and it's hard, and it's tough. It had been worn into a smooth semicircle by the action of the heart beating against it. The heart hadn't quit, the bullet had. There's a fantastic strength in living things and ability to recover. I want to tell you one other case of a little girl. This is a little girl that, at age also about 3.5, was quite sick. She was taken into Nyack General Hospital, where she was diagnosed as having lymphatic leukemia. Symptoms were runny nose, cold, low-grade fever, headache. She was never terribly sick, but they did a blood count, and they found that her white blood cells showed 76% lymphocytes. And this is diagnostic either for leukemia or for some other very serious condition anyway, lymphocytosis at the very least. So they then did a bone marrow test. And they took marrow out of the breastbone and examined that under a microscope, and sure enough, lymphatic leukemia. Well, they gave her a transfusion of packed red blood cells, and they sent her home, and she was fine for a couple of months, and then she got sick again. She always ran the low-grade fever. She had always the runny nose, but nagging symptoms, nothing serious, except when she got terribly, terribly weak and tired all the time, then they take her back into the hospital, shoot her full of packed red cells, and she was fine for a while. They turned her out, they loosed again, and then gradually she'd go downhill. The only trouble was the periods of sickness and tiredness were getting more and more frequent, and the periods of feeling well were lasting shorter and shorter. She was, in fact, failing. And then she began to get aches and pains in all of the joints, which indicated it's getting pretty near to the end. And at this point, something very fortunate happened. Her father was putting some siding on the house, and he fell off the bottom rung of